I stand here waiting for you to play the song, to crash the critics saying, is it right or is it wrong?
Human herpes virus 1, HHV1, is also known as herpes simplex virus 1. It is typically the cause of cold sores around the mouth. Human herpes virus 2, HHV2, is also called herpes simplex virus 2. It is typically the cause of genital herpes, a sexually transmitted infection. Human herpes virus 3, HHV3, is also called varicella zoster virus. HHV3 causes chickenpox. It can also cause a recurrent virus infection of the skin. Human herpes virus 4, HHV4, is also known as the Epstein-Barr virus. It is the major cause of infectious mononucleosis. Human herpes virus 5, HHV5, is the official name of cytomegalovirus. CMV is also the cause of mononucleosis. Human herpes virus 6, HHV6, is a recently observed agent found in the blood cells of a few patients with a variety of diseases. It causes roseola. Human herpes virus 7, HHV7, is even more recently observed and is closely related to HHV6. HHV7 can also cause roseola. Human herpes virus 8, HHV8, was recently discovered in the tumors called capiosis sarcoma. These tumors are found in people with AIDS.
For this PSA, we're going to focus on the human herpes virus 2, which is also called herpes simplex virus 2. It is typically the cause of genital herpes, a sexually transmitted infection. Most individuals infected with HSV1 or HSV2 are asymptomatic or have very mild symptoms that go unnoticed or are mistaken for another skin condition. As a result, 87.4% of infected individuals remain unaware of their infection. When symptoms do occur, they typically appear as one or more vesicles on or around the genitals, rectum, or mouth.
Herpes is actually very easy to get if you're not careful. You may become infected with herpes if your skin, vagina, penis, or mouth comes into contact with someone who already has herpes. You are likely to get herpes if you touch the skin of someone who has herpes sores, blisters, or a rash already. But the virus can still spread even when no sores or other symptoms are present. In some cases, you do not know you are infected. Prevalence rates are actually very interesting for herpes. The CDC estimates that annually 776,000 people in the United States get new herpes infections. Genital herpes infection is common in the United States. Nationwide, around 15.5% of persons aged 14 to 49 years have the HSV2 infection. The overall prevalence of genital herpes is likely higher than 15.5% because an increasing number of genital herpes infections are caused by HSV1. HSV2 infection is more common among women than among men, 20.3% versus 10.6% in 14 to 49-year-olds.
As for prevention and treatment options, there is currently no cure for herpes. Antiviral medications can, however, prevent or shorten outbreaks during the period of time the person takes the medication. Several clinical trials have tested vaccines against genital herpes infection, but there is currently no commercial available vaccine that is protective against genital herpes infection. These medications help relieve pain and discomfort during an outbreak by healing the sores more quickly. They seem to work better during a first attack than in a later outbreak. Correct and consistent use of latex condoms can reduce the risk of genital herpes. However, outbreaks can occur in areas that are not covered by a condom. The surest way to avoid transmission of sexually transmitted diseases, including genital herpes, is to abstain from sexual contact or to be in a long-term, mutually monogamous relationship with a partner who has been tested and is known to be uninfected.
We believe that all this can be related to the health belief model. The perceived severity of not having protection is obviously the risk of getting herpes and also getting different STIs or STDs. Your perceived susceptibility is that you're more susceptible to sickness, STDs, herpes, sores, and etc. that could get worse and worse. Your perceived benefits, however, of being very healthy and using protection is that you stay healthy if you use a condom, and you also have no risk of a disease if you choose to abstain from sexual activity. Your perceived barriers, however, could be that one could like sex too much. Condoms are also inconvenient and cost money. The last part, which is cues to action, is if a doctor emails you the risk of the worst possible thing that could happen to you from sexual contact. Also, talk to your family members, and they could tell you the risk of having too many partners or being too sexually active while being unprotected.
During our research, we found many websites that were helpful in informing us on the disease of herpes. One website that we found was a pharmaceutical website that gave us the breakdown of each individual type of herpes. Another website we found was a CDC website, which is the Center for Disease Prevention and Control. And this website informed us of how herpes can be contracted and the rates among each age group. Another website we found was the Medline Plus website. This website gave us great information on herpes, such as how it can be prevented and any treatment options that are available currently.